there's some truth in that. There's
Yeah.
something to be said about that. I really like that one. But I'm really, dentistry is, it's just a really neat place to be right now. It's a really neat profession to be involved in. There's a lot of stuff that's happening right now in research areas, and we're learning all kinds of new and different things, and it's amazing how much we know, but then equally amazing how much we don't know about the body, about everything from dental materials to the way the body responds to treatment that we do, all of those things. A lot of stuff we know that it works. I know that if I do this, if you have that situation, that chances are pretty good that the outcome will be good. I know what to do, but we don't always know necessarily why that works. We don't necessarily know the mechanisms behind why some of the things that we do work. And the more we learn about that, the better we'll be at figuring out different things to do that are even more effective. And we're learning stuff like that every day. That's the other cool thing about being in academics, is being able to be actively involved in research and actually adding stuff that's truly significant to the body of knowledge. You know, they talk about the big body of knowledge, and to be able to be involved in stuff that actually adds to that body of knowledge that's powerful, and that's cool. And to actually have, and it's a privilege to be able to do that. And I've been very fortunate that I've had opportunities to be able to be involved in clinical research. Not everybody gets a chance to do that, and I was really fortunate to be able to have those opportunities pretty early in my career. And if you learn to do it early, then you just are able to add to that as you move through your career. And I've been lucky to have those opportunities, and that's one of the most rewarding things I've done, I think, in my career is actually be involved in clinical research and do things that really have meaning, that affect people for years down the road, because you worked with a new technique, you worked with medication, you worked with something that people start using, and they start using it all over the world, and that's cool.
Yeah.
Very cool. So that's another neat thing about academics that you don't necessarily think about, but those opportunities are there, and we need good people coming into academics. Because of it, we were talking about the fact that not everybody who is trained in dentistry can also teach it, and not everybody who is trained in dentistry can do research. And those people who can probably should, if they have the opportunity to do so. That doesn't negate the fact that we need lots and lots of people going out and establishing practices and treating patients, but we do need people, good people who are interested in it, who really want to do that, to do research and to teach the next generation of dentists. We've got to have people involved in dentistry at other levels besides just grassroots practice of dentistry. So that's where I ended up, and it's worked out pretty well. So far, so good.
So why University of Louisville over another school? What makes it different than other schools?
You get a great education. I believe that we do a very nice job of balancing the basic science behind dentistry with teaching the clinical aspects of dentistry. It's a great balance. You walk out the door with the ability to do all kinds of clinical dentistry. You have a really strong start to be able to learn to do dentistry in a private practice. Because mind you, our goal is to create practitioners who are competent beginners, because we don't call it practicing dentistry for nothing. You learn for your whole life. We are creating lifelong learners, because that's what has to happen. Dentistry is moving so quickly that what somebody learned in dental school 20 years ago or 10 years ago, even 5 years ago in many cases, things have moved and things change,
Mhm.
and you have to be a lifelong learner. You have no choice to really stay cutting edge and stay as current as you can be and be as good as you can be. You have to continue to grow your knowledge, grow your skills, know what's going on in the profession, know what's going on in research. You serve patients in the very best way that you can when you're keeping up with everything that's going on. And you can't just think you walk out of dental school and you're done with that and you're never going to have to learn anything else in your life again. It doesn't work that way. You have to be a lifelong learner. And one of the things that we really try to do in dental education in general, and particularly here at University of Louisville, is to create that ability to be a lifelong learner. That's not something that necessarily everybody gravitates toward. And we try to really help people understand how they can do that. It's because it's not easy. Once you get out there and you're practicing, how do you access information? What kinds of continuing education or good continuing education courses to take? How do you evaluate the literature?
Mm-hmm.
How do you not get fed a line by somebody who's trying to sell something that really isn't something that is based in science, that is just a product that somebody's just come up with that doesn't really have anything backing it? How can you tell the difference between the stuff that really works versus the stuff that somebody dreams would work but really doesn't? How can you tell? And do you understand the difference between what works in your hands and what you think works versus things that have been studied appropriately and have been proven to really work? Those are two very different things. And how do we help people understand the differences in those things? And that's something that we really try to emphasize. We try to make a big deal about it in school, is how do you think critically? Critical thinking is a skill. It's not just something that people just instinctively know how to do. Some people are better at it than others, I think, just instinctively. But it is truly a skill that you can learn. And to be able to think critically is absolutely essential in dentistry. You have to be able to do that. And there is more and more emphasis in dental education on critical thinking skills. That's another thing that is probably a really good piece of advice, is for somebody who's thinking about dentistry, is anything that you can do to help develop those critical thinking skills before you come to dental school. You're going to do better in dental school if you can think critically, because that's part of the emphasis in our curriculum and what we're trying to teach people how to do. So the more experience you have in it beforehand, the better off you're going to be in dental school. And that's not something that we talk about very much in traditional admissions kinds of things, because it's a little hard to talk about actually, and it's difficult to assess. It's kind of like ethics. How can you assess whether or not somebody is ethical? And we certainly want our students that come to dental school and enter the profession. Stop and think about it. When somebody starts dental school, they're actually entering the dental profession at that point in time. Now, they're kind of probationary dentists at that point in time as students, but they are a part of the dental profession. It never ceases to amaze me, and you consistently hear this over and over again. Once people find out that you've been accepted to dental school, before you have ever set foot in the first class or learned the first thing about dentistry, you automatically are somebody that starts being a source of information for them. They'll start telling you their dental stories, they'll start asking you questions, asking advice. You've never even set foot in dental school, you don't know the first thing about it yet, and people already are looking to you as an expert, looking to you for information. And that's a little scary for people who are just starting out, but it also illustrates how people feel about once you're headed down a path like that. You start really early developing a feel for how people feel about dentistry and the respect that they have for the knowledge that we have, and people are hungry for those sources of information. And if they find somebody they're comfortable with, and they find somebody that they feel like they can ask questions or tell a story about some of their experiences, and they wonder if this was this an okay experience? Was this something, does this happen all the time? They just don't know, because everybody's experience is so individual. But as students, you are very much a part of the profession, and as such, you have to act like an ethical professional. That's part of what you gotta do, and that's a little hard for people to put their heads around sometimes, and it's really hard for us. There's no test that we can give, at least not yet.
Mm-hmm.
There's no test that we know of, no evaluation, no index of the potential for ethical behavior, or your I'm gonna make up a word, your ethicalness. There's really not a way to be able to look for that, and yet it's one of the most important parts
Mm-hmm.
of entering a profession is, are you gonna be able to act ethically? And we don't believe that you can teach somebody to be ethical, but we do believe that you can give somebody the tools that they take their inherent ethics that they learned when they were little kids. You know, that you start learning ethical behavior when you're just a little kid from your parents, probably, as much as anything. We believe that we can give people tools to work with to be able to act ethically, professionally, but we don't believe we can teach ethics. As, you know, you already are or you aren't, or you've already established that. By the time you come to dental school, you've already pretty much established where you are in those kinds of lights. So we can't teach that, but what we can teach is give you tools to be able to work with that. But that's a real important part of being a professional. So that's another thing we don't talk about very much in admissions, is it?
Mm-hmm.
But it's important. Maybe someday we'll be able to give somebody a test.
Well, there's a type of interview movement that's interviewing about ethics.